World AIDS Day coming up on the 1st of December, we're reminded that the world has been dealing with two pandemics, HIV and COVID-19. But how has this current pandemic affected those living with HIV? And with the hope of a COVID-19 vaccine, will it reach those that need it the most? I discussed this and much more with Winnie Byanyima, the Executive Director of UNAIDS, who is also an advocate of what she calls the people's vaccine. And I started by asking her where we are with the fight against HIV and AIDS.
Sadly, we are not. And the picture is mixed. At the last count, we had 1.7 million people who were newly infected last year. That's 3 times over the target that had been set. We had 690,000 people who died of AIDS-related illnesses, and that's also way above the target. At the end of this year, when the current targets end, we will be pleased to say we have about 30 million people living well on treatment, but we will be 4 million lower than the target that was set. So we are off track. What hurts me even more is that 5,500 adolescent girls and young women are getting infected every week. Every week. In this region alone, Sub-Saharan Africa is 4,500. So it's a very African problem that our girls and young women are 4 to 5 times more at risk of HIV than boys and men of the same age. So we still have a long road to go. We were off target before Corona hit. Now with Corona, we are even farther off target. So we need to get back on track if we are to achieve the 2030 goal of ending AIDS as a public health threat.
And speaking of COVID, what an extraordinary year it's been. What has been the effect of a pandemic such as this one on persons who are living with HIV and AIDS? We know global supply chains have been severely disrupted. I mean, even here in Kenya, we had shortages of, important drugs like Septrin, for example. Other challenges, considering persons living with HIV are, battling many issues that challenge their immune system. And then here comes COVID.
COVID's impact on HIV/AIDS is real. We are seeing disruption of services, prevention services, such as the distribution of condoms, prevention services such as voluntary medical male circumcision. Some of these services were in many countries postponed, especially in the initial stages of the pandemic, of the COVID pandemic, because the countries were battling to begin a response to another pandemic. So we've seen disruption of prevention services, treatment, testing services also losing some of their support. But apart from the services being disrupted because of repurposing them to fight COVID, there was also the issue of people not coming forward. That's also a factor. People not trusting to come to a health center. So we have figures of almost across the board that the number of people coming forward for testing this year is less than for last year. The number of people living with HIV moving on to treatment, less than last year. So you see that there is partly falling back from coming to services, and services also weakening. We did some estimates, some modeling, and in earlier models, we feared that severe disruptions could cause even up to 500,000 more AIDS-related deaths. But more recent modeling shows that many countries quickly returned services back and are struggling hard to keep to epidemic responses. It's amazing what Africa has been able to do. In fact, there's a lot to learn from Africa. Other countries never want to learn from Africa. They like beating us down that we are the worst, but on this one, we fought hard. Remember, our countries were already highly indebted, some in debt distress. our budgets for health were reducing as debt repayments were rising. In some countries, debt repayments were higher than the total health budgets. Yet, even in those situations, we are seeing them holding to responses, trying to keep other services going like children immunization, like malaria, while at the same time fighting back against this horrible corona pandemic. But we need support. Kenya and the African countries need support, debt relief, maintaining aid levels. And all these are not coming in as they should. The debt relief is too little, too short, not deep enough and not long enough. The aid is being cut. So these are bad trends for us. So we want to see global solidarity. That's why our new report is called Global Solidarity, Shared Responsibility. We have to fight and win this together. And Africa was caught weak health systems, weak fiscal space, and weak and high indebtedness and low revenue, domestic revenue mobilization. We need support to fight and win.
And one other place regarding support and global cooperation, I mean, I think this pandemic has come at a time when there's increasing nationalism around the world. And then there's been the very speedy search for a vaccine and the very speedy progress of development of vaccines. Winnie, there are some who say that, we've seen this happening very quickly, perhaps because of the countries that have been more severely affected. This time, even though Africa has borne the brunt, but not as bad as what we're seeing in other parts of the world, and that speedy search for a vaccine is simply because of who's been affected. When you compare with the search for an HIV vaccine that is still elusive decades later, is this an assessment that you share?
This pandemic has shown that no one is safe until we are all safe. So it should be about everyone's right to health. Indeed, a lot of money has been put into finding a vaccine. But I don't look at that so cynically. It's not just because rich people were dying. Yes, it's partly that. But it's also partly because the global economy was hit hard. All our countries went into recession. Africa here, our growth has shrunk by more than 3%. Okay? So there is a need to find a solution for the COVID-19 virus in order for economies to start growing again, in order that we can pay for other development objectives. So in a way, this virus has come to hit us in ways that the HIV pandemic isn't hitting us. It isn't wiping out economies. So to focus on getting a solution for this is the right thing to do. I wouldn't look at it cynically, but I have made a point again and again and built a coalition that we need a global solution to the global pandemics. All right. Both COVID and HIV. We need global solutions for both. We can't have one problem being left to one part of the world and one problem being solved
by another part. And you've advocated for what you're calling a people's vaccine. Right. We've seen the wealthier nations booking hundreds of millions of doses of vaccines that were still in development before that even began. Yeah. And whilst we report about the successes of these vaccines, how realistic is it that we would be getting some of these? We hear of the ones with Pfizer and Moderna. They've, gotten some emergency approvals. That's for, the US. But how realistic is it that we will get these by the end of this year, maybe next year? And if you were calling for a people's vaccine, how would we get that vaccine to us here?
If you take the three together, $1 billion for the United States, booked out of the three. European Union, $850 million booked out for themselves. UK, $195 million for just their one small country. In total, 14% of the total population, the rich countries who constitute 14% of the total population, have booked out more than a half of all the doses available today. So that tells you how inequitable our access is to the vaccine. Now, there will be a few more that are breaking through. We know of about 9 others that could quickly come to be licensed, but still, they don't have the capacity to produce for the whole world. Even if 10 of them, they will not be able to. So that's why we are arguing that there must be no monopoly on the production. Production must be possible in all regions of the world so we all get served at the same time. There must be no monopoly of supply, so that even if I'm not producing it, at least I should be able to have enough doses to supply everywhere. Third, there must be transparency in pricing, because these vaccines have been paid for by taxpayers' money. $2.5 billion went to Moderna, taxpayers' money. The same with Pfizer. It got money from the German government, from the European Union, from taxpayers. So that must be discounted from the price so that there is a fair price and we are not outpriced out of a life-saving vaccine. Third, fairness in allocation. It doesn't make sense, moral sense, or financial or health sense to vaccinate a healthy young person in the UK and not vaccinate a health worker here in Kenya who is facing the risk every hour. So we want that in the allocation, in every country gets enough to vaccinate its health workers first, elderly people, and people with underlying conditions. That's about 20% of the population. We are all contributing. Here in Kenya, trials are taking place. Those people who are putting themselves forward in Kenya, in Uganda, in South Africa, are contributing to the innovation. We should be in the decision making, our governments. Even if we are not in the trial, the fact that this is about, it's existential, it's about our lives. We should be at the table in global solidarity, in a spirit of shared responsibility, deciding on how to price and allocate this vaccine. And don't get me wrong, I'm not saying nobody gets profit. No, but I'm saying you can't put profits above lives. We must first save lives and then talk of profits.
What would you say then have been the lessons from COVID-19 and from HIV and AIDS?
We have many lessons about how to fight a pandemic that we share. One of them is that you must put human rights at the center of fighting any epidemic, because epidemics, they thrive on where inequalities in rights are. That is where they grow, those cracks of inequality. So if there are people who are ignored, who are discriminated, who have no human rights, the epidemic will stay there and always come back to everybody. So put those who are left behind, who are discriminated, at the center, serve them first. That's how you'll quickly get out of a pandemic. That's what we learned with HIV.
Indeed, and thank you very much for speaking with us.
Thank you so much.
Asante sana.